I'm Justin Gillenwater. I'm the medical director of the burn unit at the Southern California Regional Burn Center at LAC USC. But I have a lot of success with the amalgatome on difficult to harvest areas like the abdomen or maybe over bony prominences, say on the back or hip area. And yeah, I use it basically for both excision and graft harvesting almost exclusively now.
Great, great. And do you feel that the wound bed is better prepared? Like you were saying, it's more precise. So do you feel that you get a better wound bed?
So absolutely, for more superficial burn injuries, mid-deep dermal burn injuries, where there may be some intact dermal elements, I feel like I'm able to precisely debride intradermally as opposed to a Weck or Watson blade, which almost, I'm usually taking it down to fat. So I will say that I'm able to retain more dermal elements and have a better looking wound bed with the amalgatome than my traditional methods of excision.
I think we're hearing that universally.
And it's especially true with intradermal excisions. Now, when you have a full thickness wound bed that's going down to the fat, that's kind of, I actually think it excises fat better than Watson or Weck as well. It just kind of evenly distributes that pressure across the guard with a even depth of excision, and it's just an easier it's an easier motion. You're not having to do all the back and forth you do with the Watson, and it's just a simple drag. You don't have to push down. There's not a lot of pressure required to use it. In general, like I feel like my grafts are better with the amalgatome than they were with the dermatome.
Yeah.
Especially over difficult to harvest areas. But in general, you can get to harder to harvest areas easier with the amalgatome, and you can kind of contour to the body contour because of its really harvesting in a 270-degree arc as opposed to the dermatome, which is just a straight blade and you're pushing or whatever.